Nonprofit hospitals, of course, don't have to pay taxes, and in return, they're expected to invest money in the communities they serve. Democratic Governor Jared Polis really lit them up in this week's State of the State address, accusing some of the largest nonprofit hospitals of hoarding money and overcharging patients. Politics guy Marshall Zellinger got a hold of a new financial report out today.
Just like your personal savings account, hospitals have a reserve account meant for a rainy day, or should we say snowy day. The state's Department of Healthcare Policy and Financing, known simply as HCPF, released a few reports today that appeared to defend the governor's criticism of nonprofit hospitals saving too much money and not giving patients relief.
We applaud hospitals that are on solid financial ground. It's when the reserves are excessive that represents overcharging of communities, businesses, and families who should not be paying excessive prices.
HCPF's director, Kim Bimsteffer, pointed out an example of what the state believes is excessive saving. In 2021, UC Health, a nonprofit hospital, had 469 days worth of savings.
There is no credible advisor that would say 469 days on hand is the right amount of days. That's excessive. And that represents individuals, communities, and families that were overcharged for services, and that's the behavior that has to stop.
A UC Health spokesman said today those savings are down to 308 days.
All hospitals in Colorado, regardless of how stable they might have been in the past few years, are now faced with a really uncertain environment.
Jeff Tiemann is the CEO of the Colorado Hospital Association and points out the data provided by the state is historical from more than a year ago and does not take into account inflation, higher expenses, and workforce shortages.
I think it's important to make sure we're looking at where we are now versus where we've been.
A recent report from the Colorado Hospital Association shows collectively hospitals spent $1.6 billion for the community's benefit in 2020. Think of community benefit as how nonprofit hospitals make good for not paying taxes. The bulk of the $1.6 billion was on free and reduced health care and care that was not reimbursed. The state is seeking more accountability. Are hospitals providing what the communities they serve are asking for?
Think of what tax dollars might go towards. They might go towards helping people with housing, might go towards food insecurity.
I hear about increased reporting and transparency requirements. We're open to learning what those might look like, but think that there's a lot of that in place now.
Hey, look who got to work from home today. If you've ever looked at your hospital bill or medical bill, you understand this is not a very easy to understand topic. The state wants hospitals to lower their reserves, reduce prices for everybody, and they want some sort of accountability that state lawmakers would have to pass as a bill to put more onus on these hospital organizations. And Kyle, I was told by the Hospital Association, there have been 17, by their count, recent policy changes, and they want to see those policy changes in action first before the state comes back and says, hey, let's do 18, 19, and 20 now.
17, that's a lot. That's almost as many Emmys as you've got behind you there. Marshall, thank you.